dimpling of the breast skin, lumps or swelling in the armpit areas, pain or discomfort in the breast, thickening of the skin. Did you know these are symptoms of breast cancer? My name is Doctor.Global. Let's discuss this disease in more detail. Breast cancer overview. So, breast cancer develops in the breast tissues, typically in the ducts or lobules, and affects both men and women, though male breast cancer is rare, accounting for about 1% of cases. Did you know that breast cancer is the leading cause of cancer-related deaths among women? It primarily affects those who are over 50 years of age. The statistics are quite sobering, with a death rate of 19.3 per 100,000 women per year. About 13% of women will face this diagnosis at some point in their lives. However, there is hope. Approximately 96% of those diagnosed at an early stage of breast cancer survive, compared to 38% at more advanced stages. This underscores the importance of regular checkups and early detection. Now, let's talk about classifications. Most breast cancers are carcinomas, specifically adenocarcinomas, which begin in the milk ducts, ductal carcinomas, or in the lobules, glands producing milk, lobular carcinomas. Other types of cancer, such as angiosarcoma, can also form in the breast, but are less common. Breast cancer can be classified based on its stage as non-invasive breast cancer, also known as stage 0 or carcinoma in situ, accounting for 20% of cases. It remains confined within the breast's ducts or lobules without spreading to healthy tissue. Invasive breast cancer, making up 80% of cases, spreads beyond the ducts or lobules into healthy breast tissue or beyond the breast to lymph nodes or distant organs. The following stages of invasive breast cancer development are distinguished. Early breast cancer is characterized by a tumor that has not spread beyond the breast or axillary lymph nodes. Locally advanced breast cancer spreads beyond the original tumor site to nearby tissues or lymph nodes, but does not reach distant parts of the body. Metastatic breast cancer spreads to other parts of the body, such as the bones, liver, or lungs. Advanced breast cancer is a term used to describe both locally advanced inoperable breast cancer and metastatic breast cancer. Let me tell you a bit about breast cancer molecular subtypes. The hormones estrogen and progesterone stimulate the growth of some tumors. Thus, it is critical to find out whether a cancer is estrogen receptor positive, progesterone receptor positive, or negative. HER2 is a receptor linked to cell growth and is found in roughly 20% of breast cancers. Tumors with high HER2 levels can be treated with specific anti-HER2 medications. Tumors can be classified into subtypes based on hormonal and HER2 receptor status as follows: luminal A-like, luminal B-like, HER2 overexpressing, triple-negative tumors. The precise cause of breast cancer is unknown, but several risk factors have been identified. Being female. Yes, just being a lady can make you more prone to breast cancer. Age. As you get older, especially once you pass the age of 50, the risk goes up. Hormone replacement therapy. Late pregnancy. Having your first child after turning 30 can also play a role. Family history. Women with a first-degree relative who has had breast cancer are twice as likely to develop the disease themselves. Another risk factor is mutations in the BRCA1 and BRCA2 genes, which can cause up to 10% of all breast cancer cases. Body weight. Being obese can increase your risk, so keeping fit is key. Drinking alcohol can also bump up your risk. Radiation. If you've been around a lot of ionizing radiation, it might also increase your chances. Having discussed the risk factors of breast cancer, let's now turn our attention to its symptoms. The first symptom to pay attention to is the appearance of lumps in the breast. This could be something unusual that you notice by chance. Next, Pay attention to changes in the nipple, such as unusual discharge. It is also worth checking for any swelling of the breast, changes in size. Changes in skin color around the breasts can be a sign of disease. Dimpling of the breast skin, lumps or swelling in the armpit areas, pain or discomfort in the breast, thickening of the skin. If you notice one or more of these symptoms, do not delay visiting a doctor. Screening. Screening mammography uses low-dose X-rays to identify early breast cancers. Recommended frequencies are annually for women aged 45 to 49, every 2 years for those 50 to 69, and every 3 years for women 70 to 74. Diagnosis. Initial examinations for breast cancer include clinical examination of the breasts and lymph nodes, mammography, and ultrasound scan. Breast magnetic resonance imaging is also performed in some cases. If a tumor is found, a biopsy will be taken to assess the cancer before any treatment is planned. Methods of breast biopsy procedures are fine needle aspiration biopsy, uses a thin needle to remove a small cell sample. Core needle biopsy utilizes a large needle to take tissue samples for testing cancer markers like hormone receptors and HER2 gene status. Axillary sentinel lymph node biopsy is a surgical procedure where the first few lymph nodes receiving drainage from the breast are removed to check for cancer spread. Genetic testing for hereditary breast cancer is provided to detect mutations in the BRCA1 and BRCA2 genes. Next, let's discuss the treatment. Management for breast cancer varies based on the type and stage of the cancer. Surgery. Different types of breast surgery are performed based on the specific needs of each case. A breast-conserving surgery involves removing the cancer while leaving as much normal breast tissue as possible. Some forms of this operation are lumpectomy, quadrinectomy, partial mastectomy, or segmental mastectomy, depending on how much tissue is removed. A breast-conserving surgery is primary treatment for non-invasive breast cancer. A mastectomy is a surgical procedure that removes all tissue from a breast. A radical mastectomy includes removing the entire breast, all underarm lymph nodes, and the chest wall muscles beneath the breast. Breast cancer is treated in hundreds of clinics worldwide, using various approaches and equipment. However, not everyone knows that the cost of treatment in different countries can vary widely, even with the same high level of quality. For example, procedures such as radical or simple mastectomy can cost twice as much in China and Italy as in Egypt and Colombia, but half as much in Germany and Singapore. In order to find the appropriate treatment conditions in advanced clinics around the world, we created the Doctor.Global service. The platform is designed to help people get a second or third opinion, choose the best clinic location, or find the right cost and treatment date. We act as an involved mediator, helping to obtain comprehensive information from clinics, translating and organizing the patient's medical records in any language, and enabling the patient to make a meaningful choice of clinic or doctor. Follow the QR code link, click Your Request at the bottom of the screen, and describe your case. We will contact you back for confirmation and immediately start searching for treatment options, considering all your wishes. Nothing is more valuable and important to us than your health. All right, let's continue. There is also systemic treatment, which includes chemotherapy. Chemotherapy is an important treatment approach for breast cancer, using cytotoxic drugs to destroy cancer cells. Oncologists may recommend chemotherapy before breast surgery, neoadjuvant chemotherapy to reduce tumor size, or after breast surgery, adjuvant chemotherapy to lower the chance of cancer coming back or metastasizing. Chemotherapy is often the primary treatment for advanced breast cancer that has spread to distant organs. Hormone therapy. Hormone therapy is used only for cancers with estrogen or progesterone receptors. Some drugs prevent hormones from binding to cancer cell receptors, Others decrease body's hormone production. Immunotherapy. Immunotherapy uses drugs to boost one's immune system to destroy breast cancer cells. It is particularly useful in certain aggressive or advanced cases like triple-negative and metastatic breast cancers. Radiotherapy. Radiotherapy for breast cancer uses targeted radiation to destroy cancer cells and reduce the risk of recurrence. It can be administered externally through external beam radiation therapy or, in some cases, internally through brachytherapy. And finally, follow-up. Annual mammography and physical exams are recommended surveillance strategies for people who have been treated for breast cancer. Hope you have learned something useful today. Do not forget to like this video and share with your friends. We sincerely wish good health and success to you all.